We start this hour, and she has been kind enough to give us multiple ongoing reports, and that's Dr. Jody Dionne-Odom, Assistant Professor of Medicine in the Division of Infectious Diseases. She's one of these on the front line trying to get the answers that everybody wants from UAB out of our home city of Birmingham. And Dr. Odom, thank you for joining us again on the Rick and Bubba Show. I hope you're well.
Thank you for having me. I'm happy to be here again.
Well, follow the science, Dr. Odom. Follow the science, and I sure hope we can break through the propaganda to get to the science. God love you. You are out there trying your best to give us the science, and of course, once it becomes political and agenda driven and all that, we almost have to. I know the hours you guys are putting in, you don't really have time. Like Dr. Burke said the other day when somebody tried to go back on some bizarre comment, she's like, "We really don't need to be talking about that. Can we please get to the disease?" So we'll try to stay in your lane, which is the actual science and the disease. So we did see though. Now we're having some of your fellow doctors in different fields, that are talking about one of the concerns, and I wanted you to address that first. And that is they're trying. We want to find a way to be as safe as possible. The science is showing that COVID-19 is highly contagious, which we've heard from the beginning. We are seeing some good news that the death rate is now again. All of us have had things happen with family members and people we love, and it could be 0.2%. But if you buried one of your loved ones, for you it was huge, and we don't want to make light of that or to treat that as it's no big deal. But I would say the same thing in the 2017, 2018. Flu season or 2018, 2019 flu season. If your loved one was killed by that flu, this flu is not any more heartbreaking than that one was for you. So we are looking at the death rate appears worldwide and across our country to be holding pretty steady at less than 1%. Can you update us on that?
Yeah, so the comparison to regular flu is about 0.1%.
Right.
So 1% is still about 10 times higher than regular flu. Sure. But what you're seeing is that before we were talking a lot about doing testing and making diagnoses of people who were in the hospital. So that's that 15% that are the sickest. They're obviously going to have a much higher death rate than if you look at everyone in the community. So as we're testing more people in the community and seeing people who are doing pretty well, may have infection but don't feel that bad, that death rate falls because the number of people we've tested and the denominator is higher. You follow?
Yeah, it's all relative. But
exactly.
But
the more you test, the more you see the less infected the people who are less seriously ill, then the death rate will fall.
Death rate goes down. The data is driving the death rate down because the data is showing us we had a lot more people with this than we thought, but that also confirms highly contagious. But
yes, exactly.
But it also may confirm, and this is the second thing I want to ask you about, that we may have had this around longer than we thought. That was one of the things I got confused on the comparisons of the flu seasons when they were throwing out the numbers, but then you look and you say, well, that's over 21 weeks. Well, that's nearly that's 5 months. But they said the flu season starts in October. We're actually at the end of the flu season, so those comparisons might be you can make those comparisons because we're getting to the end of the 21 weeks. But do you think I'll ask you the specific question, do you think is science showing us that we may have had this around longer than we thought?
Remember that at the beginning of any epidemic or pandemic, especially a new one like this, no one really knows where it is or how far spread it is. So that's sort of par for the course with these new diseases. I do think that we're still looking at cases seen in China in late November, early December, and we're seeing now some cases that were probably circulating in the U.S. and California in the middle of January. But that's looking backwards, right? It's seeing someone who died then not knowing what they died of, because a lot of people in January have fever and trouble breathing, and now recognizing that it was COVID-19. So I think overall, yes, it's a little earlier than we thought, but it's not like this was circulating in 2018 or all through 2019.
No,
it's still a new virus.
Of course. And Bubba, you can answer after this because I had one more question. Can you help, because I think this is important for you to try to help your colleagues in the medical field. Some people, and I think it's a legitimate concern, we're going to have to start giving some reassurance, practicing safety with people who are hypertension, diabetes, heart disease, now some of the primary doctors are saying our offices are empty and people are afraid to come. And now we're worried about indirect unnecessary deaths tied to COVID-19, that people who have other issues that normally are under a doctor's care are not coming in for their appointments, and they're afraid to. And so is that legitimate? And can you kind of speak to that for some of those patients?
Yeah, it absolutely is, and I'm really glad you brought it up. I think that's one of the indirect, like you said, effects of the pandemic. You worry about people not taking their medicine for diabetes, hypertension. We honestly even worry about people sitting at home having chest pain, not wanting to go to the emergency room. Right. Some of them are having heart attacks and strokes at home because they're so worried about going for care. So we want to be clear about the messaging. Follow up with your doctor, take your prescribed medicine. If you're having chest pain or you think you're having a stroke, seek medical attention immediately. Don't wait. These other things are still happening, even though COVID is happening.
Dr. Jody, I want to echo what Rick said, and just we appreciate you joining us and informing us and the audience to the very latest on this, because I know that you're in high demand right now.
Yeah, you're asking great questions. Yeah, happy to help.
Thanks. Is there anything on the front that you want to tell us that we need to know about specifically that is happening or evolving in this battle that we need to know about, maybe not getting the coverage that it needs to?
Yeah.
Well, I would say that we're actually pretty close to having some answers on some of these antiviral drugs we were talking about last week. So I don't have any new studies to share with you, but we are close. It's not going to be months. It'll be weeks until we have some data on those. And the other is the moving of the vaccines. You know, we're moving from early phase into phase 1 for a lot of different vaccine products. And I was listening to some scientists talk over the weekend about a number of really promising vaccines that are coming. So just to say that even it may seem like we don't have news, but the work is being done, and this will be coming out soon.
Is it possible with the effort that's going on now? It's almost kind of like a Manhattan Project or an Apollo project where we have everybody looking at one thing. Is it possible that we may have some research come out of this that's going to help us with other virus things, even the great common cold coming out of this?
Yeah, coronavirus usually is not this type, but usually kind of a common cold virus. And people have been working for a long time on a universal vaccine that would get the common cold and get all of the flu viruses, and even an antiviral that would treat lots of different viruses. So that's sort of the holy grail of the field, because all of these are different. So to have one treatment or one vaccine that is broad coverage is pretty hard to make, but a lot of smart people thinking about it.
Dr. Odom,
I think with all that brain power and all the research, maybe there'll be some correlations come out of this, and even make a dent in some other things that, have plagued us so heavily over the years, cancer and other things. I hope there's some good byproducts that come out of this, kind of like we had, even though in the space program we were trying to get to the moon, but we had so many good things come out of that. And so many things even come out of the research trying to build the first atomic bomb that we still use today, that for positive and good things. And hopefully we'll have that in this too. Yeah,
I think so. It's too early to say exactly what we're going to have as advances, but there's no doubt that all these people collaborating across the world and working together and thinking hard about this problem is going to help us.
So
go ahead, Rick.
So let's take the break and we'll come back. And, I want to, Bubba, I know you've got some more questions, and you certainly do those, but I think we need to talk to her about somebody who needs to be studied, and that's Charles Billingsley.
Yeah.
I'm sure our friend does not want us, offering him up as a study case, but I really think he could be helpful, and we'll tell you about what happened with him. And he was a person who had severe, problems with it, but some other things were kind of odd.
Rick and Bubba.
You remember, Dr. Odom, Bubba and I had a Spanish teacher that fled Castro, who was trying to kill and jail her family, and she said teaching the two of us Spanish made her consider going back to Castro. so anyway.
Si, senorita.
So let's talk a couple of things we want to ask you about before we wrap up today. Let's talk about the concerns, and I started getting emails from medical doctors because, we want to get back. We want to keep moving. We know it's contagious. We are thankful that the death rate percentage is going down, but still some issues because this is a novel coronavirus. We've never seen it before. And one of the things that you guys can you update us on the concern about blood clots?
Yeah, so we're seeing it more and more often, but we even were getting reports out of Italy and out of China that they were seeing it there too. What we're seeing is much higher percentage of people, especially the sickest who are in intensive care, having blood clots in their legs, blood clots in their lungs, and even blood clots going to their kidneys and going to their brain and causing stroke. So we had young people, previously totally healthy, have blood clots that have been devastating because they go to bad places. So there definitely seems to be an association. Exactly why it happens with this virus, we don't understand yet, but we're trying to understand it.
That was kind of my follow-up, is why it was happening. Do you think, it may be unfair because you may have already answered this with your statement, but do we think it is a direct result of that, or is it indirect, through dehydration, laying around for an extended period of time? Do we have any idea on that, Doc?
Well, the thing is, patients in the ICU sort of by definition are relatively immobilized, and we're seeing a higher rate of clot compared to other patients in the ICU. So I think it's something to do with the virus. It may have something to do with the ACE2 receptor the virus uses to bind to get into cells, is related to the control of hypertension and the control of some of the things at the level of the vessel. So I think it's a basic interaction between what the virus is doing in the body, which is leading to the stroke.
Dr. Jody, are there any other meds or treatments out there that seem to be showing some success just far as making people more comfortable or giving them, cutting down on the length of time of this? I mean, not the vaccines or all of that, but some of the, like we had one with a story about it was actually some stomach medicine that may be helping.
Yeah, so there's a study right now of famotidine or Pepcid, which is ongoing. There's about 470 trials of different drug treatments being tested. A lot of those are the same drugs we've already talked about, but there's new things being tried too. Everyone, like I said, is really working hard to find a treatment for this, so nothing is off the table.
So let me ask you about our friend Charles Billingsley. All right, so here was his experience. He's 50 years old. He's in great shape, really takes care of himself, healthy guy.
It doesn't look 50 at all.
No, it doesn't. I mean, it's. I know you're picturing us in your head. Don't picture that.
Yeah, no, picture somebody who's like a movie star.
I have no idea how old either of you are.
Well, I'm 50. We're both 50. I'm 55. What are you, about 56?
I'm 56 right now.
Yeah, right. Yeah, right. But you would never see Bubba or me and go, "Is that Charles Billingsley?" Right. You know what I mean? So I'm saying Charles Billingsley is, he's lean, he's healthy, he takes care of himself, exercises, doesn't have any pre-existing health problems. And he got COVID-19, and I mean, he got the bad stuff. I'm talking about really is fortunate to be alive, okay? I mean, he had the deal where they were within days of ventilator, the whole deal, and praise the Lord, he was able to fight his way out of it. He was sick for 24 days he was sick. And and he did have the leg pains, which they think might have been, they were worried at one point about the blood clotting and all of this. He was hospitalized for a few days. He was able to get himself healthy enough to quarantine at home. But here's what was interesting. He has young children. He has, a beautiful wife. And they were he thinks he got it from a woman on an airplane trying to get back home to where he lives in Virginia. And there was a woman in the seat in front of them that was wheezing, dry coughing all over the plane, sadly, I think, and all this. And he thinks that's who he got it from, because this was in the early days when we were trying to figure out where it was, what's going on. And his wife and children were not only with him on the plane, they lived in the same house with him for, I guess he was in hospital 2 days, so 22 days. He did quarantine himself off into one room, and none of his children, they just tested them again, or his wife, none of them got the virus. And we know, I mean, the science is telling us it's highly contagious. Yeah. But maybe this is some good news that we can work through it socially, even with people who have it. Does that surprise you that none of his family contracted it? I know they may not have had the same problems. We've had cases in families where somebody got real sick, somebody didn't even, it was like a cold and everything in between, but they didn't get it at all. Is that interesting to you?
It is. I mean, I think the fact that he was in the hospital and he quarantined probably did protect his family because maybe the period he was most infectious, he wasn't around them. But the other question I have is the testing they did on the family because, did they do the antibody test that looked to see if they ever had the infection, or did they do the nose test looking for the virus?
I don't remember. That's important, but I don't remember what test he said. I want to say it was the antibody test, but I may be wrong.
Yeah, so I'm thinking what they may have done, what we still have most available right now is that PCR test in the nose. And I wouldn't be surprised if the illness sort of already passed through his kids, let's say, and his kids are feeling fine, negative PCR, but they could still have antibody that they had it and cleared it.
You wouldn't be surprised if we discovered they just had no reaction to it and he did.
Exactly.
Can I ask you a question?
I also wouldn't be totally surprised if he did a really good job isolating himself and didn't come in contact with them and didn't get them sick. That's also possible.
Yeah, he said the roughest thing for him, he said, he said it was amazing how long the fever, they couldn't get the fever.
Yeah.
When you're old, when you're 50, 102 to 104, it bangs on you. A small child can run a high fever and still function to some degree. But the older you get, just any fever when you're older,
they can run around when they're young, but adults, it hits us much harder. It's true.
Yeah, it's like you've been thrown down a flight of steps.
Speedy, go ahead with your question. I wanted to ask about that fever right quick.
Yeah, no, we're wrapping up. Go ahead, because we've only got about 30 seconds, Bo.
Yeah, Dr. Jody, if you, of course, if your fever gets too high, it can do organ damage. You don't want that. But just in general, if you're in that 99 to maybe 100, 101, are you better just to let that run its course than try to lower your fever with Tylenol or Advil or something?
Yeah, in infectious disease, we usually think of the fever as a good thing. It's your body's response trying to raise your temperature to get rid of that germ. So I often don't give Tylenol off the bat for people unless they're really uncomfortable.
There it is. Oh, you're going to hear about that today.
Dr. Jody, thank you again, and all the medical folks out there who are working so hard. We really do appreciate your frontline response to this war we're in.
Thanks for getting the word out.
All right. Thanks for the call. Thanks for giving us the time.
Rick and Bubba.